as far as the diabetic patient is concerned, they have this. First of all, they are not more. They will not have more side effects than people without diabetes. So we were getting a lot of vaccines until the end of April, and then suddenly the government stopped giving us, being smaller hospitals. So we did about 5,000-6,000 people we vaccinated. Touch wood, not a single person had any problem. We didn't have a single death. We didn't have one or two had fever and so on, from which they recovered. But overall, it went very smooth. And the reason is because the side effects are not 1 in 5,000 or 1 in 10,000. It's like 1 in 1 lakh, 2 lakh, 3 lakh, more like 1 in 5 lakhs. So if we had given 5 lakh people, we'd also seen one or two, bad effects. We didn't give that many, so we have not seen that. So I cannot say that because nobody of my patient developed, they will never develop. There are some side effects after the vaccination, but thankfully they are very, very, very small. So it's like 0.01% or 0.001%. So that means 99.999% you're not going to get it. So for that 0.001%, are you going to stay away from taking the vaccination is a question. I turn it around and say, okay, if you go in a flight, there is a 0.00001% of you dying. Okay. But if you don't go on the flight, you may not have that risk. So then everybody stop flying and everybody sit at home, because then that 0.001% you can avoid, We don't even think about it, no? I used to travel, twice a week I used to be on a flight before last 1 year. I used to be twice a week I'll be on a flight. I've never thought of, oh, this one's going to crash, that one is going to crash. We take it for granted, occasionally one or two crash, We can't help it. Things do go wrong. Similarly, in vaccination, occasionally one or two people do badly. We still haven't found out why exactly they do badly. Probably they have some genetic defect, or they had some immune response which is slightly different, or they reacted very badly to the vaccination, or the body thought that it was a COVID and then developed some clot or something like that. So human biology is so varied. It's not like mathematics, not like physics. 2 plus 2 is not 4 in biology. So occasionally something will go wrong. This can happen with any vaccination. Measles vaccination, give 1 in 1 lakh people can die due to measles vaccination. Polio vaccination, something can happen. So like that, in all vaccinations, it happens. Here, it's a clotting mechanism, which is the whole thing of COVID. And that's what we're trying to do. Where if you want to produce a reaction in the body to the immune system to stimulate it, you'll have to produce something like that. Only then it is specific to COVID. Sometimes it gets exaggerated. It's not meant to get exaggerated. Sometimes it gets exaggerated. Now coming, and therefore, my recommendation is everybody pray, and everybody go and take your vaccination, because that's the only thing you have to protect yourself. As I said, among all my staff, among all the people whom I know, those who have taken the vaccination, except one or two, for everything you can find an exception. Okay, if I tell you, oh, but I know of somebody who died. Yeah, he's only one. Biology, there are always exceptions. Don't go by the exception. Go by the rule. Don't pick out one guy whom in the world something happened, and for that the whole world changed because that one guy. It doesn't work like that. In biology, medicine, it doesn't work like that. We are conscious of it. We are not denying it. We are saying, yeah, occasionally things do go wrong, but what else? You have a choice. You don't have a choice. So therefore, we do that. So everybody take the vaccine. So I think people should go ahead and take it and then wear a mask, because even after that you can get. I have seen many people after the second dose also, after 1 month also, get the infection, but they did not suffer from it, and it went off smoothly. And the rest of the family members who did not have the vaccination did poorly, they did well. So that is a proof. Ultimate proof is that the vaccine really protected you. Okay. Having said that, I know of one person who, after the second shot also, he developed severe COVID and he died also. Okay. So does it mean that, oh, then that case, one person died, therefore whole country, we stop the vaccination program? No. I know that that person also had other comorbidities. Something else went wrong. Biology is like that. Suddenly one stray thing will happen in the body. The body has its own mechanism. So never go by, I heard of this one case. Everybody hears of one case doing something. One swallow doesn't make a summer, as they say. So based on one case, never decide anything. Then you'll never decide anything. You'll hear of one Titanic sinking, so then no ships can go. You would have heard of one plane crashing, then no planes can run. Life doesn't go on that way. You'll have to find out why it sank and why it crashed, and try to learn from that, and life goes on.